They are back and in a big way. Doctors say viruses are striking earlier than usual, catching hospitals and staff off guard. The U.S. Department of Health says over 70% of pediatric hospital beds in the nation right now are full due to the spike in respiratory illnesses.
Alicia Barrera spoke to two doctors from University Health today on what they're seeing and how they're attributing this increase and what medicines to have in your cabinet.
Very congested and very contagious. Doctors now warning cases of the common cold and flu spiking.
The previous 2 years, we've had almost a non-existent season with respect to influenza or flu.
And now it's happening months earlier than usual.
We really start seeing high numbers of cases late December, January, maybe even into February. We're seeing those higher numbers now in October, which is extremely early.
Dr. Brian Alsip serves as University Health's chief medical officer. He says it's the same case for other infectious diseases, including rhinovirus and RSV. According to the CDC surveillance data, that represents about 9% of the total population. Cases of RSV tripled over the past 2 months and are nearing last year's peaks.
And I think it's not just a local issue, it's a national issue. A lot of the hospitals are dealing with a high number of pediatric cases. And so we actually have conversations about how to collaborate amongst the hospitals locally.
Doctors attribute this in part to people letting their guard down after COVID by no longer wearing masks or not washing their hands as frequently. But they say the first step to staying healthy is prevention.
If you have some congestion, certainly saline nasal sprays. As it gets wintertime, the air gets dry, so your nose patches get dry too. After a nasal spray, you can overuse it. And if you use it too much and then stop, then you're going to have a really runny nose.
But if you do get sick, experts warn about medications, specifically combination products, as more often than not, they already include ingredients such as Tylenol and acetaminophen, and you want to be sure that you're not consuming too much.
University Health Pharmacy Director Dwayne Davidson says, always read the label, especially if you have underlying health conditions.
You don't want to exceed more than 3,000 milligrams or 3 grams a day for most people, and sometimes even less than that, depending if you have some liver conditions.
Doctors say the best form of prevention this season is the flu shot. Alicia Barrera, KSAT 12 News.